I will not have any complications. I will have a good birthing experience.
April Valentine said these affirmations every single day. She thought she would live to see her first child, Anaya, born. But April didn't make it out of the maternity ward at Centinela Hospital in Inglewood, California.
April Valentine was 31 years old.
Now, following months of protest, that ward is set to close October 25th, 2023.
Oh, no.
Valentine's family filed a lawsuit on Tuesday, alleging in part wrongful death and professional negligence with demand for a jury trial. The Valentine family filed a complaint with the Los Angeles County Board of Supervisors, alleging systemic and racist practices and seeking answers regarding the circumstances of her death.
We are here to amplify the story of April Valentine.
An initial inspection of Valentine's incident found Centinela failed to prevent the deficiencies that caused or are likely to cause serious injury or death. The LA County coroner ruled her cause of death on January 10, 2023, a blood clot, which the hospital failed to assess for and intervene in.
Come on, my little jitterbug.
Valentine's partner, Nija Robertson, and her sister, Keisha Cordova, were at Centinela during the labor. They allege Valentine's doctor, Gwen Allen, did not arrive to the hospital for hours.
They said, well, we can't call the doctor will cuss us out. The doctor don't like us calling her.
A formal inspection saying the hospital repeatedly failed to notify the physician as Valentine's vitals became abnormal. They allege as the hours went on, nurses were inattentive, turned her doula away despite previously greenlighting it, and pressured Valentine, who wanted a natural birth, to get an epidural. Soon after, they allege Valentine's legs began swelling and she threw up. Valentine's partner and sister say eventually April stopped breathing, but nurses did not perform CPR, so Robertson did. According to the inspection, minutes later, doctors intervened with CPR, but April died. Their baby delivered by crash C-section, unresponsive but alive. Beyond Valentine and the maternity ward, an ongoing NBC investigation found substantive instances where Centinela failed to keep records and notify physicians and family about patient pain and conditions. Following a public information request, NBC obtained statements of deficiencies and plans of correction, outlining incidents at Centinela, including failing to notify family following a drastic change in patient condition, ongoing reports of rodent activity in the hospital due to an unfixed broken door that was later fixed, and, in one case, patient death as a result of failing to ensure proper medical care. Documents say the hospital took plans of corrective action, including multiple incidents of staff counseling and re-education, random cleanliness tests, and, in at least one case, employee suspension and termination. In a statement, the attorney for Valentine's attending physician, Dr. Gwen Allen, said Dr. Allen is prohibited by federal law from publicly commenting about her treatment of Ms. Valentine. Dr. Allen did not cause Ms. Valentine's death. In a statement to NBC, Centinela Hospital Medical Center said, in part, the center disputes the allegations made against the hospital and is dedicated to delivering compassionate, quality care to all patients. The center denies allegations of systemic racism, noting that their healthcare team reflects the varied ethnic and racial makeup of the community, adding that the hospital has been recognized as a top national facility. Centinela says they're closing their maternal ward due to an exponential decrease in demand for maternal health services. Though the ward will soon be gone, Valentine's family says their fight to preserve her legacy is only just beginning.
When she gets older, what are you going to tell her about?
Her mom, I'm going to tell her her mom was an amazing woman with a great personality.
And Zinkley Asamoah joins us now for more on her reporting. Zinkley, this story is heartbreaking. When it comes to stories around Black maternal health, this is not an anomaly, right?
Gotti, that is 100% right. We know in the United States, the reality is Black women are 3 to 4 times more likely to die from a pregnancy-related cause. That's compared to white women. And medical experts have rightly pointed out this is not some predisposition we have, right? Much of it stems from medical implicit bias and systemic lack of resources to this specific community. Now, California, where you are, is unique in that its maternal death rates are among the lowest in the country. Actually, you can see it there on your screen. But even still, Still, for black women in California, just like April Valentine, that rate of maternal death is more than 3 times higher compared to white women still. And so Valentine's family tells me they are devastated that she became one of those statistics, but they are hoping for what they're saying, #justice for April Valentine. And to them, this lawsuit filed today is just the first step of many. And notably, the state of California also issued that hospital, Centinela, a $75,000 fine earlier this year. So this is just the beginning of this story. They cited an unidentified maternal death and hospital administrative penalties. So a lot to follow here, but clearly every life matters, including April's. Gotti.
Such an important story. Zinkley, thanks so much.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.